Hey there, I'm Dr. Shah Mahmood, and I support GP trainees with their SCA preparation, and we've been doing that since December 2023. Now, if this is your first time here, then please do check out our feedback videos on our YouTube channel or podcast, and you can hear from lots of different trainees. Now, in this video today, we're going to hear from Dr. Mikaela Wardle, who's a GP ST3 who sat her exam very early in her ST3, and she passed with a remarkable score of 112, which is almost perfect. She was a very, very good trainee, and she's actually going to be joining us on Sunday, the 18th of August, where we do our first live SCA teaching session. Now, before we go into the interview with Dr. Wardle today, I just wanted to chat about what we've been doing at WellMedic and what's going to change. So at WellMedic, we've been running an SCA course and a coaching program now for a little while. Now, with the course runs by sharing pre-recorded videos, examples, feedback, SCA cases, and the theory of consulting, all of which Mikaela refers to within the interview itself. However, from August, what we're doing is we have brought the price right down from £300 as a one-off price to £9.99 per month. And within that £9.99 per month, you're going to get access to our live teaching sessions as well. So the first of that is going to take place on Sunday, the 18th of August. Now, it's a full day event. It's going to be with a medical actor, and we're also going to have Dr. Wardle there as well with us as well, sharing her input. So it's going to be a really, really good event. And within this monthly package, you actually do get 2 of these live sessions for, well, not for free because you are paying a monthly subscription, but within your monthly subscription. So it's huge value for money. So please do join us. I hope you enjoy listening to this this interview and this video. And if you are interested in the SCA course and the live education package, then please do share it with your peers as well, because the more trainees that we have, the more benefits you're going to get. So if you go onto our website, wellmedic.co.uk, and you look at the SCA course and teaching package, all of the information is there in terms of what you're going to get now and what you're also going to get in August, depending on how many trainees sign up on our early bird offer. So this £9.99 per month is an early bird offer. So thank you very much, and I hope you enjoyed the interview. Welcome to this feedback session. I'm joined by Mikaela, who's an ST3 who's recently passed the SCA exam. Hi, Mikaela, how are you?
Hi, I'm good, thank you. Glad to have the exam out of the way. So yeah, very happy at the moment.
Absolutely. So why don't you tell us a little bit about yourself, kind of what's going on in life in general, and whereabouts are you training?
Yeah, sure. So I'm a ST3. I'm based in central Birmingham. I'm working in King's Standing at the moment. And I started ST3 in April, so just been going for a couple of months, and did the SEA in June.
Awesome. And just to clarify, are you part-time or full-time?
So I'm 80%. I was full-time until the start of ST3, and then at the start of April dropped down to 80%.
Excellent. And did you how many months in general practice have you done in total? How many did you do in ST2? And
So I did 8 months so 4 months in ST1 and then 8 months in ST2, and then have just done a couple of months in ST3. So I'd probably done just over a year, 14 months by the time I'd done the SCA.
Excellent. And tell us about, because it's quite quick into ST3 that you've kind of taken the exam. So what would you say the benefits are in terms of doing it quickly?
Yeah, so I think I was initially thinking of doing it a bit later, but I chatted to my ES about it, and she thought I was ready to give it a go a bit earlier on. And I just quite like getting exams out of the way if I can, because they do stress me out a bit. So I tried to my ES thought I was ready, so I thought I'd just set myself a challenge to see if I could get it done at the start of ST3, thinking if I failed, it would be I could just do it again. So it was. I think there's pros and cons to doing it early and leaving it a bit later. But for me, it worked quite well to try and get it done a bit sooner.
I guess you don't have to then plan for extensions and things like that as well.
Yeah, and thought there's still lots of portfolio stuff to get done. So if I could just do the exam, get that out of the way, then I can focus on everything else before I CCT.
And how long was there between your AKT and SCA? Was it a while?
So I did the AKT in October last year, so October 23, and then did it in June. So about 6, 7, 8, about 9 months, which I
Mhm.
think was quite helpful because you do a lot of the SEA. You still have to, even though there's lots of kind of communication skills and things like that, you do have to have a good, solid knowledge base for how to manage things. And I do think having not left it too long between the AKT and SCA, there was still stuff that was still fresh in my mind, which was helpful in terms of management.
That's really important because off camera we were talking about the event that's taking place on Sunday the 18th of August, which is our first education session for the new SCA package, and part of that theme is going to be around kind of medical complexity
Mm.
and multimorbidity. So if you think about kind of management plans, you said it was helpful that you'd sat the AKT recently. Did you have to kind of troll through your notes for the AKT, kind of remind yourself of management plans, or how did you approach that aspect of the exam?
Yeah, so I think for some things I did have to look over the management, but I do think generally a lot of the stuff that comes up in the SCA is things that you do see on an everyday basis. There's lots of chronic disease management, more kind of, yeah, your diabetes, COPD. There's a few other, there is also a management of acute stuff, but quite a lot of it is the stuff you do see on a day-to-day basis. And if you have a general overview of how to manage it, um, I think for a management perspective from the SCA, it's okay. So I would say generally it was mainly just by seeing patients in clinic, making sure I looked up on CKS or GP Notebook how to manage a case after I saw a patient in clinic. That was probably the main way that I went over my management stuff. But yeah, for some things I did kind of scroll back through my AKT notes, but generally it was more based on, I think a lot of my knowledge was just from kind of seeing patients in clinic and practicing scenarios.
Excellent. One of the questions. So what I did before this session was I asked some trainees if they'd like to ask you some questions, and so we've had some questions come through, and one of them is around kind of using your general experience
Mhm.
in general practice to prepare for the exam. Now, do you feel that? So you've mentioned some positives in terms of using it from a kind of management perspective. Do you feel that there's any kind of negatives in terms of how real life general practice might influence or affect your preparation for the SCA?
Yeah, so I think with a lot of general practice, your consultations aren't as straightforward or aren't as smooth running as you would expect from an SEA case. For example, patients come in with lots of different problems, or you may need interpreters, or you get interrupted, things like that. So you do. Whereas in the SCA, quite often, well, you do kind of have to stick to quite a specific structure to make sure you're getting your kind of data gathering, your management, your interpersonal skills, that you're getting marks for all of those. And I think realistically in a consultation, depending on what the scenario is, but for example, where I work, you have to use interpreters quite a lot,
Sure.
that sort of thing. It does make it a bit more tricky to kind of cover this clear structure that you need to use for the SCA. So yeah, I would say the advantages are that it is good for management. It helps you to kind of think laterally, which you do have to do a lot in the SCA. But the SCA, you do generally need to stick to quite a clear structure to make sure you're getting all the marks, which doesn't always apply to a case. Quite some cases you get in general practice, I would say.
Makes sense. While we're on that kind of theme of kind of using your normal practice, one of the things that we did when we were doing the coaching was look at cases whereby you have to give a patient results.
Mm.
Um, and there's generally kind of two ways that people do that. They either take a history again, or maybe for the first time if it's like routine kind of bloods that have been taken, to contextualize the result, and then they go through giving the result, and then they kind of data gather again to
Mm.
understand the patient's ice and so on. Or some patients, some trainees will just give the result straight away and then do all the data gathering. How do you kind of generally approach that in your day-to-day practice, and did you approach that specific scenario differently when you were preparing for the exam?
Yeah, it's a good question. So I think in a day-to-day practice, I would probably just give patients the results first, just because I think when patients phone in for results, they're often anxious. They want to know what they're dealing with. They want to know, yeah, what they've come in for. So I would do that more in day-to-day practice. When I first started practicing for the SCA, I did it the other way around. So I would make sure I got all the data gathering questions, then would give patients their blood test results or scan results. However, towards the end, I changed back to doing what I did in clinical practice. I think there's different ways to doing it. But for me, I think that worked better, mainly because patients often want to know the results of their tests, and you can kind of gauge if they're nervous or apprehensive about it.
Yeah.
And it also helps you to, well, I found that it helped me to kind of focus my data gathering questions a bit better, rather than just asking lots of vague questions, not vague questions, but asking more kind of wide questions and then giving them the blood test result. Whereas you can maybe tailor it a bit more specifically to the blood
Exactly
test
that.
result if you do it the other way around.
Absolutely. And when it comes to the idea, concern, and expectation, there's very little benefit of ascertaining their ICE pre-results,
Mm,
because the likelihood is that the result itself is gonna impact on what they feel about that
yeah.
result and what their expectation then becomes, in terms of what that result shows as well. So I think that's really, really important. Now, in terms of kind of approaching the exam, kind of talk me through kind of a broad structure or strategy that you kind of followed leading up to the exam.
Yeah, so I started preparing at the start of March, so that gave me 3 months.
Mm-hmm.
So initially, I wanted a group to practice with. So I sorry, I had two different groups to practice one with. One group was just people from my VTS, who I'd also, and yeah, a group of people from my VTS, and then the other group was a group of people who I actually met on the Well Medic course. Just we met virtually and we met up and practiced. And
Mm-hmm.
that was probably the mainstay of how I prepared. So initially, for the first couple, let's say for the first 2 months, we'd meet up maybe 3 times a week just on Teams and practice some cases.
Mm-hmm.
We would we kind of mixed it up how we would practice it. So sometimes we would just do random cases, so it's more like the exam, you don't know what's coming. Or sometimes we would say we would choose a topic, for example, peds or women's health, and we would do cases based on what we decided to choose. In the month, probably from about the start of May, we ramped it up. So we were probably practicing maybe 5 or 6 times a week. Just again doing cases, sometimes chatting through management. And that was the main, I would say that was probably about 90% of the way I prepped. The other way was just reading over guidelines and kind of management kind of stuff. And then also, I think from being in clinic, just if I was unsure about how to manage a case, would just make sure I looked it up rather than just leaving it. Or yeah, would probably pay a bit more attention into kind of how I was making sure I knew what I was managing on a day-to-day basis from that side of
Excellent,
things.
excellent. Oh, that's really helpful. I guess that kind of highlights the importance of needing to practice. How do you feel the feedback that you received from a program like ours, where we're intensely listening to every word and question that you ask, and let's say when you're preparing with a friend who ultimately is often being the actor as well, so you're kind of working in that type of format. And similar thing, if me and you were working together, it's much more difficult for me to be an actor and listen at the same time. So that's where the kind of medical actors help. How do you feel that differs in terms of like feedback from somebody who's looking in on the consultation and feedback from somebody who's actually doing the consultation with you?
Yeah, so I think it is definitely helpful to have a third person there to kind of listen to what you're saying. Because
Mhm.
yeah, as you say, when you're if there's just two of you, sometimes you don't pick up on just kind of the way you phrase things, or just kind of subtle cues, or things like that. Because if you being the patient and the examiner, it's quite difficult to do both of
Mhm.
those.
Mhm.
I think by having someone completely separate, so someone who's not doing the exam, who's not practicing with you, observing you, it's also helpful just because yeah, again, it just helps you. Sometimes you don't realize, I think if you're all practicing together all the time, sometimes you don't realize what you're doing wrong, or you don't realize, you just get so used to practicing with each other. It can either be difficult to give honest feedback if you need to improve on something, or you don't realize if all of you are doing the same thing that you need to improve on, you don't notice. So having someone fresh, a fresh pair of eyes coming in is really helpful
Yeah.
to give you
The,
some
re- the
feedback.
reason why I mentioned that is, how you were working with some trainees within the Well Medic program. So there was a couple of things that you all were doing that were very similar that I'd started to pick up on.
You
You're
picked up
obviously
on.
learning off
Yeah,
each other.
so
I was like, this
yeah,
is like the third time I've had this today, and they're like, oh yeah, and I was like, by any chance are you working? Ah, yeah, we're working
yeah, so
together.
yeah.
Not always bad, like good as well. Like you do pick up on like
Yeah,
subtleties. So I guess you start to mirror communication, and
yeah.
I think that's an important thing to do. Now, if a really interesting thing that I always kind of remember about my experience of going through the RCA at the time was I felt that I was so much better at communicating after sitting the exam than I was before sitting the exam, and I felt that I was a much better clinician for it, and that my general consultations were better. How do you feel that that transition's been kind of from when you first started ST3 to now kind of having gone through quite an intensive, revision structure? Do you feel
Yeah.
that you're better, worse, indifferent? Where would you like?
Yeah, I would say I'm better. I think I was a bit skeptical, to be honest, when I first started revising for the exam. I thought the exam's kind of is a tick box thing you just have to do. You have to ask the right questions. It's not really going to change my practice. But I do actually think it has made me better at consulting. I think it's made me a bit better time management wise, because you kind of get it in your head you need to be in 12 minutes. I think it's also made I'm much better at explaining things in sort of patient language to patients. I think before that I was probably using a lot of technical language without realizing it. Patients probably weren't understanding as much as they are now. So I think my ability to explain things in lay terms is much better than it was before, and also just it's becoming a lot more natural now just to make things more patient focused, to ask about ice. It just kind of comes off the tongue, like rolls off my tongue now, whereas before you kind of had to sometimes remember you need to get what the patient's view is rather than just speaking. I think beforehand I was probably doing probably too much talking and not enough listening, whereas now I'm much more aware of that and think that's much better in my consultations.
I think that's a really interesting point, because I think generally in general practice, so I've been a GP now for 3 years. I actually find that I ask less questions now than I did when I was first a GP. And I think part of that was I was always really worried about missing a red flag, and I think I'd kind of program myself in that way. Whereas I think you can get a general gist of what the person wants from the consultation just by listening to them and giving
Yeah.
them that ability to speak about and just directing the conversation. And I think that's a really important skill. And I can definitely say you had that skill kind of during our sessions where you were able to direct the patient just by using kind of subtle questions. And then, of course, just kind of when it got to the point where you did need to ask those specific, like the red flags, you were able to do so. So I thought that was really, really interesting. Now, um, in terms of like just the resources that you did use through WellMedic, like how would you say kind of they benefited you, or of course didn't benefit you, and what would you say to kind of any trainee that is thinking about either our coaching program or using our course?
Yeah, so I think yeah, in the Well Medic course, but it was very helpful. I'm not just saying I wasn't just saying that. I think for a number of reasons. So from the course in general, I think the videos or when I did the course, it was you would kind of watch a set of pre-recorded videos. I thought that was really helpful for getting a good clear structure, and the videos clearly broke down how to kind of do each part of the consultation and how to ask the right questions and things not to miss, which was really I thought that was really helpful. It was also helpful to have a good bank of a good bank of cases, and then to see an example that recorded as sort of an example consultation, so you could kind of pick up on phrases or just see how to do things well, how to do things less well. So I thought that was very helpful. So yeah, I think they were probably the most useful things.
Mm,
I did use a few other case banks. The groups that I was practicing with, we had a mixture of resources that we would kind of share between each other.
makes
So
sense.
that was good for getting the sort of actual breadth of cases and actually getting the practice in. But in terms of the videos about how to kind of approach a case, getting a framework and a structure for your consultation that you can take to any case, the Well Medic videos are really helpful for that.
So thank you. Thank you. We are increasing our case bank actually, so we've gone up to 50. So there'll be a lot more coming your way. In terms of the cases, like especially the ones that we did on a kind of one-to-one basis. Now, often the feedback we get that they're quite challenging. Do you feel that they did challenge you, or do you feel that they could have been more challenging?
So compared to the actual exam itself, I think the exam was really fair in terms of the cases that came up. Nothing out of the ordinary or something that I really didn't expect to come up came up.
Mhm.
So I think the exam is fair. In terms of the cases on the Well Medic course, I think there was a mixture of different cases on the course, but I would probably say generally, if anything, the Well Medic ones were maybe a bit more challenging in some respects. Again, on the exam, there were sort of different complexities of cases. I think the Well Medic cases, quite often there's lots of information to read beforehand, which I often found difficult. Which in the exam, there were a few cases with lots of information, some with less information. But I think practicing those on the course and with you was really helpful, just to get used to reading lots of information in 3 minutes and then you working out how you're going to use that for your actual case.
Interestingly, so because we've made changes throughout each sitting. So we've kind of done January was the first exam that we prepared for, and then we've done kind of Jan, Feb, March, April, May, and then now June. And now we've got a little bit of a break, which feels a bit odd for me because I'm not as full on at the moment as I have been. But interestingly, when we first did it, we kind of did the opposite, where we had kind of slightly easier cases and maybe not as much reading, because what I didn't necessarily want to do was kind of terrify people before the exam. And I feel that we've got maybe a bit of a balance now, but you're right, we have tried to include cases where there is a bit more reading so that you then have to utilize some of the medical records within the consultation, which is a difficult skill. I don't think it's particularly easy, but in some ways, I guess ultimately all of this is reflective of general practice, in the sense that there's going to be cases where the patient expects you to know what's already in the notes, right?
Yeah.
How many times the patients, you ask them a question, it should be in the medical records, right? So it's that balance, and of course, being able to accept that sometimes there's going to be a patient you haven't seen who's been seen by a specialist, who might have been discharged, who might be unhappy with the treatment that they've received, or they've waited ages to be told that it's something that could have been done in primary care. These are all dilemmas that we do face in modern day general practice. So if there's one kind of last thing that you would like to say to somebody who is kind of preparing for the exam, what would you say is kind of the silver bullet in terms of trying to pass this exam?
Oh, good question. I think there's lots of different ways of doing it, and people approach it in different ways. I think for me, the way I learn well with other people. So having different groups to practice with was really helpful. So I would probably say just practice. Try find maybe several different groups to practice with, because you learn lots from different people, just in terms of how they communicate, in terms of their knowledge to manage a situation, a scenario or not. So I think I was a bit worried when I first started revising that I wouldn't have anyone to practice with, because there weren't that many, because I started in April. Most of my friends weren't kind of doing it at the same time, so that did worry me a bit. But just look for people to practice. There'll be lots of other people in the same boat who are also looking for people to practice with, and just make a group or two groups and practice regularly. I think that's probably the best way to do it. And just be honest with your feedback as well, because I think it's really difficult, especially if you're practicing with people you don't know that well, to kind of be honest. But then at the end of the day, you do kind of need to be honest with each other. So don't be afraid to give constructive feedback, because I think we all value getting constructive feedback, and we all want to improve and pass.
Absolutely.
Yeah.
Absolutely. Now, just finishing on the teaching event that we're doing on Sunday the 18th, and you'll be joining us for that as well. So what can trainees expect from yourself in terms of how the session that you'll be running within the day session?
Yeah, so I think I'll chat a bit about kind of what exactly, as I say, there's never one way of doing it, and there's lots of people have passed doing different things to me, but just what I did personally to kind of try get through the exam. And then we'll go through a couple of cases, just in terms of things similar to what came up in my exam, or cases that could come up in the exam, and just how to manage them from a kind of time management point of view and a complexity point of view. If you're dealing with lots of problems or patients who've got lots of issues going on, how to kind of manage that in the 12 minutes.
Excellent. And that's going to be the theme of the day, in terms of thinking about medical complexity, and thinking about chronic disease management. And as you said, lots of the bread and butter stuff that we see in general practice that we should be comfortable with, but how it might be slightly nuanced in terms of how that stuff might be tested in the exam, rather than just straightforward hypertension management, for example. So yeah, it'll be really good, and I'm really looking forward to it, because it's going to be a new element to what we've offered on the Well Medic program, and ultimately it's down to people like yourself, Mikaela, that trusted Well Medic with their preparation, and it's by running through the sessions with you that we've been able to adjust and iterate what we can offer other trainees as well. So thank you for that, and thank you for the time that you've taken today. I'm sure many people are going to benefit, and it's going to be a pleasure working with you in August as well.
Great. Thanks, Sean.
Awesome. Thank you. There you go. That'll stop.